Assalamu alaikum, dear doctor. In this video, I am discussing immunothrombocytopenic purpura ITP from NICE Guideline. So first, definition of ITP. That is, platelet count less than 100 into 10 to the power 9 per liter, usually less than 20 into 10 to the power 9 per liter. ITP is self-limiting disease with shortened platelet survival and increased megakaryocytes. Good prognosis. Acute, persistent and chronic. Acute duration is 0 to 3 months. Persistent is 3 to 12 months and chronic is more than 12 months. Now, symptoms and signs of ITP. These are acute onset bruising, purpura and petechiae, serious mucosal bleeding, unusual, look for other causes, preceding infection, absence of hepatosplenomegaly, lymphadenopathy, evidence of serious cause or any chronic underlying illness. Now, investigations of ITP. That is full blood count, blood film and clotting. Blood group, if headache and or neurological signs, urgent CT scan of the head. Bone marrow aspiration unnecessary unless neutropenia or severe anemia, hepatosplenomegaly, lymphadenopathy, pallor and lassitude, pain limb, abdomen or back and limb. Other investigations are cytomegalovirus and Epstein-Barr virus, immunoglobulin M. If risk factor, then HIV, hepatitis B and hepatitis C. Now, treatment of ITP. Immediate treatment is that none regardless of platelet count unless life-threatening owing to significant bleeding. If significant bleeding, example uncontrollable epistaxis, GI hemorrhage, intracranial bleed, give platelet. Along with methylprednisolone 30 mg per kg per day by IV infusion, maximum 1 gram per kg for 3 days. Or immunoglobulin 0.8 to 1 gram per kg can be repeated once within 3 days if required. Add indication in the demand management program for immunoglobulin. If moderate bleeding in ITP, example prolonged mucosal bleeds, give prednisolone 2 mg per kg per day for 14 days. Then taper over 21 days. Or prednisolone 4 mg per kg per day for 4 days. Or immunoglobulin 0.8 gram per kg IV single use. Consider tranexamic acid for small bleeds. Avoid NSAID, example ibuprofen. Reassure parents. Discuss newly diagnosed ITP with the pediatric hematologist, pediatric consultant with a hematology interest. Discuss treatment with platelet with pediatric hematologist in event of essential operations and emergency dental extractions. Now, subsequent management of ITP. 75 to 80% resolve in 6 months. Favorable outcome irrespective of treatment. Avoid contact sports. Impossible to prevent fighting, rigorous knock about the game set home. Monitoring and treatment of ITP. Full blood count and film monthly until diagnosis clear or recovery. Repeat sooner if bleeding or increased bruising. Discharge and follow-up of ITP is that discharge from long-term follow-up when platelet is more than 100 into 10 to the power 9 per liter and asymptomatic. Advice of risk of relapse 20%. Note that mothers with history of ITP, even if they have normal platelet counts, can give birth to thrombocytopenic babies. Now, how can we manage chronic immunothrombocytopenic purpura? We know that chronic ITP duration is that more than 12 months. So, in case of chronic ITP, we avoid NSAID, avoid contact sports. Investigate for autoimmune disease, ANA, that is antinuclear antibody, APLA, antiphospholipid antibodies, SCA, anticardiolipin antibody, anti-LSC, lupus anticoagulant, and immunodeficiency, HIV, immunoglobulin G, immunoglobulin A, and immunoglobulin M. Treat only when profound thrombocytopenia less than 10 into 10 to the power 9 per liter with repeated mucosal bleeding, number 1. Number 2, older girls with menorrhagia, and number 3, trauma. Number 4, acute neurological signs. If treatment indicated, give prednisolone 2 mg per kg per day 14 days, then taper over 21 days or dexamethasone 0.6 mg per kg per day, maximum 40 mg orally for 4 days. If ongoing bleeding, must have bone marrow aspirate before treatment. If unresponsive, discuss with pediatric hematologist about treatment with rituximab or thrombopoietin receptor agonists. Splenectomy reserved for those with persistent or significant bleeding, non-responsive or intolerant of other therapies. So this is ITP from NICE Guideline.